Good evening, everybody. Thank you for joining us at Monarch Family Chiropractic for our Tuesday night spinal workshop on the subluxation complex. I'm Dr. Kristen Zawada, and we welcome you to joining us in learning and knowing more about what you get adjusted for, what we're looking for, what a subluxation is, what it makes up, what does it affect, who does it cause to do something different, and how does that change the trajectory of our health? So we're going to jump right in to looking at some scenarios of what is happening, what we call a subluxation. But before we go into some definitions, I really like looking at breaking the word down. When I learned the word subluxation 20-ish, years ago when I started school, and hearing that word, sub is less than and lux is light. So in thinking about how we are energy, we are light, we are a signal flowing through from the top down and down back up in that feedback loop, it's less than light, normal light, right? Less than the amount of light we need. So it's an area in the spine that is also in a dysfunctional state. So it's affecting our health and our well-being from the sense that it's creating an effect or a result onto the nervous system, right? So that's what it's influencing when there is a kind of the concept of a bone out of place, right? Or looking at a physiological change in the system. We are a muscular skeletal system, right? So we need the movement of the structure, which is attaching to all the muscles that are getting their signal from the nerve, telling the body what to do, telling the muscles how to hold us, react, let go, engage, right? So bone is functioning or moving in a less ideal way, right? In a manner that is not normal to the body. So kind of dis-ease or dysfunction. And with chiropractic care, we're looking to, again, detect and correct those subluxations, right? We want to restore the healthy function. So yes, there's movement that it is a part of, but it's much bigger than that. And it's much more important than that in the sense of how it creates overall function and vitality in the system communicating, right? So more than just an improper or a out of place position. Really, so as we talk about in all of our workshops, we're about ultimately creating more potential. So of course, no surprise to anybody on our workshops, we're going to talk about the brain and the factor of why that's so relevant in that it's retaining the ability to adapt, right? That's what neuroplasticity is. So if it's ever, changing throughout our environment or throughout life, it's got to have that. The body's got to retain its ability to adapt, and it's got to have that plasticity. So movement over time and understanding that plasticity is a huge component of body and brain adapting to what it has to do in our environment. So importance of our brain, right, to maintain an accurate and up-to-date inner map. So it's really our GPS system and a lot of what our DNA and our mapping is from our brain through our nervous system to all of our parts and pieces, right? So the location of where things are at and where the joints are, we are three-dimensional beings. So that's why we spend so much time talking about both, all dimensions, right? We take that posture picture we're looking at, we want to see movement and where you think you are, your body and brain think it is in space, do those subluxations left to right, but also forward and backwards. So that's why we spend so much time checking that very often, because those are things that our brain starts adapting to and then thinks is normal movement or a normal position. And it's just compensating for the subluxated poor position or poor inability to move or to function in the place that it is. So it finds a new normal, right? And we're wanting to change that and really stretch and challenge that plasticity to understand different movement. So perception, right, of reality and simply what your brain considers to be, or your brain's translation and interpretation of all that information that gets it from its sensory receptors, right? So our skin, right, our biggest organ, our biggest sensory organ, ears, eyes, and again, of course, muscle activity too. So we did this drill a couple different times earlier in the year, but I like this example using it here with, eyes interpret the color or object based on what color we think it should be, or what we're focused on, which is influenced by other colors of nearby objects. So one fun little drill to do when our brain fills the gaps of what it knows based on past experiences or what it expects to happen or to be. And that those senses are sending information to the brain, and the brain's then going to compute that information into its own personal, if you will, reality. And that there isn't any one. So I guess what I would say is if we wanted to do this drill wherever you are, out in homes or here in the office, we are going to pick looking for everything that is the color green around us. Okay, so you're going to take a quick glance and a full 360 around you. What do you see that is green?
Orthotics.
We got lots of green in this office. Okay. And it's always interesting to take a look at if we were looking for a different color, did we even see it? And if we were expecting to be looking for something specific, if you look back around, is there anything that maybe wasn't green, but you could play it off as green and you convinced yourself it was a version of green, right? And there's lots of shades of green, and we have lots of shades of green in this office. But there's times that when you're looking for something, we also can, in a sense, trick our brain into seeing or thinking we see something else. Again, it's pulling in part of perception and what goal we're after, what we're after there. So talking about subluxation and how it affects the brain, leading to, the changes of the information and the signal that is getting from the spine from that body, from that sensory input back to the brain. So we look at it as a segment moving away from normal is not moving much at all. Or is it just moving differently from normal, right? And the change in the information to the brain leads to a change within the brain itself. So again, that neuroplasticity. When a segment doesn't move properly, it's influencing how the brain perceives and responds to all the other sensory input and information coming in. So where it thinks it is in space. So sometimes when we do other tests with you, it's because we're testing, what does the brain think? We see what the body's doing, but it creates its own reality in that moment. So this is a good, I think, visual in looking at how we are wanting to understand where movement and abnormal versus normal movement creates either normal function or dysfunction, and how that translates through the brain. So looking at if a spinal segment or groups of segments, right? When we lose spinal curves, in this view right here from the side view, we want that S curve in our spine because we want curves that go in a C shape and a backward C shape. That changes how the body and how the spine and rest of the system either get stress upon it or don't. And so when we have those healthy curves, it's distributing weight of our body evenly. So it's getting different spinal information sent to the brain and the nervous system if that joint or movement is abnormal. It's then processing that different, right? So it's a dysfunctional process that's integrating by the brain and the nervous system, and then it gives us a different output. So input into brain doesn't equal the same good output if it's not understanding the way it's coming in and being received, right? So poor control of the spine and the body leading to then poor movement, which then can lead to pain, overuse, or dysfunction in that joint. Just like in the adverse way, if we are getting really appropriate spinal and joint movement, right? Through the adjustments, through watching that mobility is everywhere, not just parts and pieces, that the body and the spinal nervous system is working as a team and a unit, if you will, not parts and pieces, like you hear me say a lot of times in the beginning, or when we find areas that don't have that same pliability and mobility, right? Things around it are usually what you feel that's uncomfortable because they're working too hard. They're doing too much work to make up for the movement that the other areas of the spine are not doing. So again, when we get that appropriate joint movement, we're then getting spinal information sent to the brain that is good and appropriate and correct to that nervous system to then process it the way we need to and integrate that out as an output and a response of, I get it, this is what I'm doing. Now I have better control, better mobility over my parts and pieces and how they respond to that movement, right? So get my face over here. read that. Okay. So when we're correcting a subluxation, what kind of things do we expect to see and do see? Many people do really talk about how initially there's such a response with mobility that they feel a difference in their more movement and mostly a decrease in the stress in that movement. But ultimately, we're looking at long-term pattern changes, right? Which it makes improved brain function and a more efficient system, meaning we're not working so hard or overcompensating in other ways to do the job we're asking the system to do, right? So we work more efficiently and usually have less stress into the system when we've improved that brain function and decreased the amount of output that has to happen in that altered way, right? So improving that visual acuity or visual field size, reducing joint position or that sense of error, right? So again, to know where you are in space, especially when you close your eyes. What about our reaction time to things? Thinking about if that is slow or fast in certain movements or situations, right? Altering the brain's processing and really changing the way that our brain is integrating not just motor information, right? The movement, but the sensory information. It is a team effort there. We've got to have the flexibility and the pliability when we're talking about that reflex excitability, but from the component of when I think about the pliability that you gain when you're getting adjusted and the subluxations are being removed is, again, the system working as a team and a unit, not parts and pieces. So a lot of restriction comes from somebody overworking because another area is underperforming and working, right? That dysfunction. And so retraining that neural pattern takes time, it takes repetition. Just like with anything else that we do, the repetition is key to teach it a new way of processing, right? Changing that plasticity. So changing the message is what just takes time to reinforce and it to get a new, clean, understood message versus one that is interrupted or a partial message. So Josie, would you grab me one of the safety pins? I know we do a whole entire workshop on the safety pin concept, but I just feel like this is one that when I'm a visual person, I was looking for some different slides that we use different analogies, didn't really find the picture that I was wanting, but I felt like using that safety pin is just a perfect example of that message and that signal. So with that message is traveling and a closed safety pin is that good feedback loop, right? It is leaving the brain. It is traveling down to those parts and pieces, organs, tissues, cells, muscles, glands, everywhere. And it is going out to that part and piece, delivering that message with hopefully more correct data, right? And it's understanding of where that message is supposed to go, how it's supposed to get there, who it's supposed to go to, and how it's supposed to be interpreted, right? And then the body does that movement, that action, that response, that component, and then that signal has to come back through, up the cord, back to the brain to say, I just did what you needed, what next? And it's doing that 1 trillion times a day for all the things we take for granted in a very blessed way, right? We don't think about how our entire digestive system is breaking down, using chemistry, absorbing our lunch, taking in what it needs, processing through what it doesn't, right? How our heart is doing its job, beating, pushing blood, pushing oxygen, what our lungs are doing, our eyes secreting fluid right now so we could blink, right? All the motor movements we do with no thought at all, that's all due to the brain and the signal traveling through this very healthy, non-subluxated loop. And so we see an increase in muscle strength when you see us test your grip strength or leg strength or arm strength, because we're testing that signal, getting down to what's about 40% of that signal from the nervous system is to that motor movement. Think about what might happen if a system is working too hard or one side's doing more of the work than the other. And then it does it so long that it's like being in the gym or doing an activity and you're at that threshold, right? Of I can't do one more repetition or one more curl or one more lunge or one more stair or whatever it is, one more sit up. It's thinking about movements where you completely kind of go to exhaustion or fatigue. And many times that can happen in the poor way, because we have lost that signal to give that motor activity the right amount of movement or control to be able to do what we need it to do. And so many times when we use this analogy, it's because we have a subluxation and we are opening up that loop, allowing for that feedback system to come down, go somewhere with more stress usually upon it. And then where it lands, we don't always know, right? If that signal does not come back up and close that loop to the brain, then part of the body may have gotten some of that signal, but not all of it. Or some of the information about what we need the body to do, but not all of it, right? So it's really looking at how do we prevent that fatigue or that overuse or that strain in the system, in the brain, to where it just literally does fatigue our brain. It makes the body work harder in multiple ways, not just motor activity, but in the brain processing. And then it just gets confused, it gets tired, it gets fatigued, and it doesn't function at its optimum. So really what we're after when we're removing subluxations is closing this feedback loop so that the signal is clear out and in and back in. So I feel like this is a concept that we cover often. We talk about these concepts in short periods a lot. And hopefully you hear the word subluxation every time you come in the office, and definitely multiple times when you're in those first couple weeks to month of care. And so this one is short and sweet. I don't feel like there's a lot of extra time needed to explain this concept in more depth per se, other than we know people who are struggling with finishing and closing that loop, right? Whether it's by movement and motion, whether it's doing certain activities, whether it's being restricted due to pain or an inability to fully function. When we see a lot of disruption in the nervous system at the brain and at that upper neck level, those are things where it can put somebody out, right? It could be something like vertigo or that dizziness, imbalance. I mean, how many people are we worried about them falling and hurting themselves in our older population, especially? But that can happen in our younger population too. I have plenty of people that come into their 30s and 40s and say, man, I'm really clumsy. That's one thing people are noticing. It's not that I'm in pain, but I am real clumsy. That's again, brain not getting right input and output to where you are in space. And so if it's even experiencing something from the opposite end of the circle of life, if you will, and it's a little kiddo, where you're noticing attention, you're noticing mood shifts that really don't seem appropriate. If you're noticing outbursts, if you're noticing or hearing things at school about their level of attention or how in which they're interacting with other kids or with their teacher or just in situations. Many, many times with lots of documented study and chiropractic with a lot of neurologists is talking about how that is such a function and lack of to the brain, that it is subluxated at the start of the signal and the body's not able to process the information that's going out or coming back in. So we see it with little kiddos all the time. And unfortunately, in the world we live in, it gets chalked up to other things. It gets chalked up to, now, not that sugar and other things wouldn't affect that too and could be causing that to be worse. But it is not necessarily what we find is the root cause. It's just it's an exacerbation of a system on overload. So any of those sensory overloads to touch, to sensations of things, sometimes to activities and the way they engage in them, or the overload in their system doesn't mean that they can't do certain things. It's that their brain is it's processing too much to be able to handle doing it, coming out with a good, appropriate outcome in that loop and going on to the next thing, right? So it's about processing. And so overload for all of us, from a young kiddo to an older adult, it's about processing and that signal being clear. So the effect and the cause, the cause may be the same thing. The effect can show up as many different things. So all the symptoms really are an effect of that perception of the brain to the body, right? So that subluxation complex is something that affects all of us, every single one. So we ask that if there's someone you're thinking of, if there's someone you know that's experiencing any of those things in lack of the best function possible, and wondering if it has to do with subluxation and the stress upon their brain, or the way in which their body is processing their world, whether they are a day old or 97 years old, send them in. It's a great time in June to do take advantage of us opening up the office to our community to do our Patient Appreciation Week, the last week of the month. So the 24th through the 27th. Our board will be up this week in the office showing the availability of times we have. They call in and let us know that they know you and they want to come get in that week. And we will set them up with an appointment to get checked at our expense and find out if any of this is due to subluxation and if we can support them in their health journey. So think of someone you know, let us know, come on in and write it up on the education station, or even just on our list that we keep of people we're thinking about, so that we can support them if and when they do call. So thank you for joining us tonight. I look forward to your takeaways and questions in the office, and we will see you soon.